Hello everyone, my name is Lydia Els-Smit and I'm an embryologist. I'm also chair of the SASREG Accreditation Committee, and the organizers of the Fertility Show asked me to present to you some more information regarding the SASREG Accreditation for IVF units and also how it benefits patients. I work at Natal Fertility Clinic and I'm very privileged to say that after a day of work behind the microscope, I can go enjoy the sunny beaches of Durban and Umhlanga. So to start off with, we must first look at what is accreditation and how this can be important for IVF treatment. I will also give a background of the SASREG accreditation system, and then hopefully by the end, you will have a clear understanding of the benefits to you as the IVF patient. First, I want to ask you a question. How do you ensure you receive the quality service or product that you expect and pay for? So depending on the product, you might not only consider what the marketing or the salesperson tells you. For example, like a motor vehicle, it is a large commitment, it's expensive, and our loved ones will travel in the car. So we can be assured that the government considers public safety, and therefore the motor vehicle at least needs to pass a roadworthy test, and the driver needs to be licensed before driving the car. But this doesn't necessarily tell you how good the car itself is, the quality of the car and how well it will drive. So we will most probably ask our friends and family their opinion and their past experience, and we will also consider whether the car is made by a reputable company. And why the brand has got significant meaning to us, it is because we know that they have a history of providing a certain level of quality product or service. But in some instances, a product or service doesn't have a reputation as of yet, and it's maybe a new product. So then companies know how important it is to build a reputation, and therefore they will ask clients or new customers to please trial their product or service and provide them with some feedback. And this feedback is not only just to attract new customers, it is also giving them information regarding the product, and that information they can use to improve their product or their service. In some instances, you need even more information. If we consider again the car, then we know that certain parts of the car needs to be of high quality. If you consider the airbags or the tires, something like SABS approval is very important because it gives us a reliable method of knowing that it has passed some quality checks by very specialized people that are recognized and unbiased from the manufacturer. And also why this is very meaningful to us is that we know that product or service has gone through a very intensive process with very specific standards, and the product or the service needed to reach quite a high compliance to actually achieve that stamp of approval. And a major element of such a process is what we call total quality management. And companies will go to large extent make a huge effort to actually have some form of accreditation or certification to show their customers that they have a certain level of quality and to distinguish them from their competitors within the market. So let's define accreditation. It is a process of quality assurance that determines whether an institution meets established standards for function, structure, and performance. It is a process to evaluate and recognize an institution for meeting peer-developed standards established to promote quality service. It is also an official acknowledgement that someone is qualified and responsible to perform a certain task. So why would this be important in IVF? Because you will most probably tell me, no, but I have the best fertility doctor and everyone told me that he is the best one and he takes very good care of me. But we must also consider the reality. And if some of you have watched the very recent Netflix documentary, then it is quite obvious that we cannot just consider one element of fertility treatment. We must actually have a lot more information. So then we need to look at who is the best IVF clinic. But this is quite difficult because every IVF clinic will most probably tell you that they are the best, and there are so many IVF clinics and so many very good IVF clinics. But how do you make the decision? With medical tourism, patients can go to any country to receive IVF treatment. And with so many options, this is quite a daunting task, and fertility patients are bombarded with marketing, especially something like success rates, which is very important, but is most probably not the only factor. They will consider the time constraints, they will consider the costs, and they don't want to compromise on anything. And yes, they need to choose a responsible fertility clinic. And then something like accreditation or a gold seal of approval really do make sense. So when we think of accreditation or product certification, the first thing that comes to my mind, and maybe some of you as patients as well, is we think about the very complicated IVF laboratory, because there's a lot of sensitive and technical equipment, specialized specifically for handling our sensitive samples. And also there must be highly trained and qualified embryologists to operate all of these equipment and systems. And yes, it is our main function as embryologists is to ensure that the samples and the embryos have an optimal lab condition to grow to their potential. So we are very familiar with quality of products. We check that all the products that come into contact with our samples, like test tubes and culture medium, are all certified to be safe for IVF use. And also the way that we handle our precious eggs and embryos, we make sure that we control these processes, because everything that we do can relate to how well the embryo can grow. But the medical doctor, apologies, The medical doctor and the laboratory can't be the only two aspects that we should consider. Oh yes, there is definitely the nurses that also assist the doctors to ensure that there's patient care involved. But there's even more to an IVF clinic. Let's think about the facility itself. When you enter the IVF clinic, do you feel comfortable? Is there enough seating when you wait for your turn for the consultation? When you have your consultation with either the doctor or the nurse, do you receive all the information to clearly understand what your diagnosis means, what the IVF treatment will entail? And our doctors also have their specialized equipment that needs to function accurately for diagnostic and for procedures. And yes, the aspiration and the embryo transfer procedures takes place in the procedure room and the ward, and that must also function quite efficiently to maximize outcomes. We also have external service providers that ensures that we receive accurate results for our hormonal tests and bacterial cultures. And then we realize that it is not only the doctor and the embryologist, there's more staff involved and much more to consider how if IVF clinic can offer a quality service to you. So the success of IVF depends on a combination of all the departments and aspects working together, integrating, making sure that the IVF treatment is effective and efficient. And success is, yes, top of the list is always pregnancy, and that is definitely a priority because that is why a patient comes for fertility treatment. But it is not the only aspect of successful IVF treatment. It is also about how the IVF treatment takes place and is the patients well informed? Do they understand? Are they treated with dignity and respect? And is there emotional and psychological support for them? Because it is not an easy process and there's a lot of ups and downs. And there's so many aspects that can affect the quality of care. Even very slight variations of, let's think about how clean the IVF unit is. It can affect the quality of care. So how do we organize all of these? And then we are back to total quality management. So it provides a system to make sure that something like IVF from start to finish can have checks and balances to make sure that the quality of care that the patient receives is in an organized manner and a controlled manner. And there's a lot of knowledge out there to help IVF clinics apply these quality management processes. So it is not new, and there is several accreditation bodies across the world, and some of these accreditation bodies is specific to the country because sometimes the regulations and the laws have an effect on how accreditation can take place. There's also international types of accreditation, like ISO, which is quite well known. And then there is society-based accreditation. And SASREG is also a society-based accreditation system. So currently, what is provided in South Africa by the Department of Health? So they are our regulators, and they currently provide certain regulations pertaining to the artificial fertilization of persons, which we need to follow. And they also provide recognized bodies for registration of healthcare professionals. Additionally, we are very glad to see that recently they've also published some clinical guidelines for safe conception and infertility treatment. But there is no registration or license process for IVF unit. And therefore, we as a society with members across the board of reproductive medicine, our specialists, our embryologists, our nurses, we are in a position to bridge the gap. We have enough experts to develop a bit more guidance and tools and standards specific to IVF in our country's context. And we also provide collaboration with other professionals and industry to provide support and network to our colleagues. So SASREG has accreditation system for the past 8 to 10 years. And it started off as a minimum criteria that focused on patient safety. So it was to have some form of minimum standards, and but as a society we are still not regulators. So it was a voluntary process, and it was set up by our own colleagues. And the process of accreditation was via peer review. But in the past few years, IVF has evolved and has expanded, and more aspects of the IVF clinic needs to be considered for accreditation. If we think about the facility, patient feedback, and applying total quality management control. So we knew this daunting task need a bit better guidance. So we asked the expert, Dr. David Mortimer from Azoa Biomedical, and he and his wife are highly regarded academics and experts in quality management in IVF. They have published many books and articles. And we also knew that we needed to expand our input from our colleagues, and we set up quite a large task team from across the country, from several different clinics, to make sure that we can gather all the knowledge possible. And we updated the accreditation system, but it is still a voluntary and peer review type of system, but we aim to include more of the IVF clinic, and also I want to bring the attention to the accreditation system involving more patient feedback and patient support services, which are very important. And this turned out to be quite a hefty document, because the accreditation system now does not only provide a minimum checklist type of system, it rather provides a framework for improving the whole clinic's IVF service. So it gives very nice quality goals and standards, and it explains why it is important, and it gives clinics some practical implementation tips and it also provides them with a way to have some evidence or proof that they have the quality control in place. It also provides them with some educational references, and we also had some educational webinars during this process. So our SASREG accreditation system also has its intensive process in place, and it gives the clinic an opportunity to self-assess if they comply with the standards, and they will need to go through a process of 3 surveyors walking through the clinic and check if they do comply with the standards, but also to help them or give them some recommendations where they can improve or make sure that they can comply. So when we give our accreditation certificate to a clinic, we can provide patients with some form of assurance that that clinic has conformance to a certain level of quality IVF care. And on our website, there is some information regarding the accreditation, and it also provides a list of accredited clinics in South Africa. And we hope that this will ease the burden of finding a responsible IVF clinic. Another benefit of accreditation is maybe one that you can directly feel on your pocket, and this is recent developments that Discovery Health now gives some medical aid coverage or funding for IVF. But this was only because SASREG could provide the embryo transfer guidelines that was set up by our peers and expert colleagues in a form of a consensus document, and also that SASREG has an accreditation system in place. So Discovery will only fund IVF at a SASREG accredited unit, and this is because they wanted some assurance that the IVF treatment the patient is going to receive is cost effective and ensures that it reduces risk, medical risk. And if we think about something like multiple births, it is not an optimal outcome for IVF to have twins and triplets because that means that there is higher risk for complications to the mothers and the babies. And if you think about multiple births as well, you consider ICU events, that is really expensive and it's really stressful. They can have, the babies can have long-term health issues. So it is very important for medical aids to know that the clinic will follow certain guidelines of best practice, and they are open to some accreditation system with high standards. We also hope that more medical aids will follow, and especially because our accreditation system also improves and looks at more and more aspects within the IVF clinic. So I hope by now you have quite a clear understanding of how accreditation works, and that the accreditation process benefits the whole IVF system to improve quality of care and improve the successful outcomes. And the benefit to the patient is actually the main aim of IVF accreditation. So I would like to take the opportunity to also thank my colleagues that has worked very hard and many personal hours during 2021 to compile all the standards. And also I want to take the opportunity to thank the surveyors in advance, because their work is from now until next year to actually do all the surveys and visit the clinics. And I would also like to thank my colleagues and members of the accreditation subcommittee. And I also would like to thank Dr. Suleiman Hailen, which is our past president, who has made it his priority to support and ensure that the accreditation system goes forward. And I would also like to thank Letitia at Turner Secretariat, which is my right hand during all these collaborations, making sure that we have an efficient task team that can work together. So I would like to invite you that if you have any further questions regarding the accreditation system, to please contact us. Letitia will gladly forward your email, and I hope we can answer your questions. Thank you very much.